Hello and welcome to class. Today's lecture examines preparedness using the all hazards framework used in modern emergency management. We will look at how preparedness works across multiple levels, including individuals, families, communities, health systems, and public health agencies. This lecture is organized around 4 learning outcomes. First, we will examine the concept of all hazards preparedness. This framework is widely used in emergency management and focuses on building systems that can respond to many types of disasters. Second, we will examine personal and family preparedness planning. Even strong emergency response systems cannot immediately assist everyone during disasters, so household preparedness is critical. Third, we will discuss community preparedness strategies. Communities coordinate preparedness through emergency management agencies, healthcare systems, and public health departments and community organizations. And finally, we will discuss the role of nurses in promoting preparedness. Nurses educate patients, support community resilience, and participate directly in disaster response. This section introduces the concept of all hazards preparedness. Emergency management professionals recognized over time that response systems share many common elements across disasters. Rather than developing completely separate plans for every possible hazard, planners build flexible systems that can adapt to many different emergencies. Preparedness refers to actions taken before a disaster occurs in order to reduce harm and improve response. Preparedness activities include planning, training, stockpiling supplies, conducting exercises, and building coordination systems between organizations. Prepared communities experience fewer injuries, fewer deaths, and faster recovery after disaster. What's preparedness to you? Take a moment and stop and think about how you would define preparedness in your life and your community. Preparedness occurs across multiple levels. Individuals and families prepare through planning and supplies. Communities coordinate responses through emergency services and planning. Healthcare systems prepare for patient surge and infrastructure disruption. And government agencies provide coordination and resources. The all hazards approach means emergency systems are designed to function across many types of disasters. For example, communication systems, evacuation planning, triage systems, and incident command structures are required in hurricanes, earthquakes, wildfires, pandemics, and mass casualty incidents. So in short, they're flexible. The all hazards framework involves efficiency because the same core response system can be used repeatedly. It improves flexibility because systems can adapt. It improves coordination because agencies train together using shared systems. So, why do we use the all hazards framework? Because it's efficient, it's flexible, and it's coordinated. Now, I would like you to pause just for a minute, and I know you're in an online course, and you're probably not going to have anyone with you to discuss with, but you can stop and think to yourself, what your emergency supplies are. So, do you have emergency supplies? Do you have evacuation plans? And do you have emergency contact plans? I would suggest that you think about the things in your daily life that you may have that could feel part of these checks. So, do you have emergency supplies? Well, the the question is, what do you consider an emergency supply? If you take a medication, do you have enough to last 30 days? If you are concerned that you could lose potable water, do you store water? I mean, here in New Mexico, we live in the desert. It would be really important to store some water. What other things could serve as emergency supplies? Well, one of the things that I do for emergency supplies is long after I quit backpacking, as I got older, I kept all the backpacking equipment. And every few months, I go in and I change out the food supplies that are in there. I make sure everything works. And I know that if I ever needed it, basically, I have something to cook with. I have sleeping bags that will keep you warm. I have tents if you need shelter. There's food, there's water, and there's all manner of first aid supplies. So what do you have? Preparedness begins at home. Federal preparedness guidance emphasizes that individuals and households are the first line of resilience during disasters. When I was working in emergency management and planning, we used to call it Yo-Yo 72. And Yo-Yo 72 meant you're on your own for 72 hours. That's about as quick as people are going to get to you in a major disaster. Preparedness guidance emphasizes 3 simple steps. Make a plan, discuss evacuation routes and communication strategies, build a kit, assemble essential supplies, and stay informed. Monitor emergency alerts and hazard information. If you don't have one of the old battery-powered radios, you're not prepared. When the power goes out and everything's down, the old AM radio will still function and you'll still get emergency messages on it. The other thing is, where do you meet your family if you can't get back home? You need a plan of where you would meet at a safe location. Families should identify evacuation routes and meeting locations. 2 meeting locations are recommended, one near the home and one outside the neighborhood in case evacuation becomes necessary. An out-of-the-area contact is also recommended because long-distance phone calls sometimes work when local communication networks are overloaded. Who would you call that's not in the local area? Are you still going to be able to call them if you don't have a way to charge your cell phone? Now, emergency kits and supplies should always include water, food, medication, and flashlights. You should have at least enough to last you 3 days. So remember, Yo-Yo 72. Water is the most critical resource. Preparedness guidance recommends 1 gallon per person per day. People with chronic illnesses must plan for medication continuity. This includes keeping medication lists, copies of prescriptions, and extra supplies when possible. So remember, people that you have medications, medical devices, and other health conditions need to have in all honesty, paper records that they keep that can travel with them, but you also need backup electronic records. The problem with having a supply of medications is most people's insurance won't pay for that. So let's pause here and let you think of any questions that you may have. Normally, if we were in person, I would say, let's have a short discussion about what we've talked about so far. But what I'll tell you since we haven't is send me your email questions about what we've talked about so far. Or post them on Canvas. And I will be happy to respond to you, or you can always stop by office hours. So in section 3, we're going to talk about preparedness and specifically community preparedness strategies. Preparedness isn't limited to your house. It is also your community. So your community must coordinate planning across many organizations. Communities develop emergency operations plans that coordinate response among emergency services and government agencies. Some key community partners are emergency management, public health, healthcare systems, fire, and EMS. Preparedness requires coordination among many organizations. These partners share information and coordinate during the disaster. Public health preparedness involves public health agencies that monitor disease outbreaks and environmental threats. They also provide health communication during disasters. Healthcare system preparedness largely involves hospital emergency plans and disaster drills. Hospitals prepare for disasters through planning and exercises. The drills simulate patient surges and infrastructure disruption. If you're not working in a hospital yet, when you do, you will realize that these disaster drills occur on a set schedule on a regular basis. And you're going to have to be prepared for these and respond to them. And you do this because disasters can happen anywhere. And it doesn't have to be something that's announced or coming forward. An example in New Mexico was one of the emergency helicopters crashed on the roof of the hospital, and the blades went through the ceiling and exposed basically the pediatric area. And the staff had to do an emergency evacuation of all those children. Sometimes the disasters are totally unexpected. We're going to now talk about an example. So the example I want to use is the Camp Fire in California that began on November 8th, 2018 in Butte County, California. Now we all know that the Palisades fire is more recent, and there are more recent fires. But this one, there's a lot of data about, and it's going to be easy for all of you to look up. It was driven by extremely dry vegetation and strong winds, and the fire spread rapidly toward the town of Paradise. Within hours, thousands of residents were forced to evacuate. So let's go through a little bit of the overview of this. The Camp Fire was one of the most destructive and deadly wildfires in the United States history. It began on November 8th, 2018 in Butte County, California, near the community of Polga, and quickly spread toward the town of Paradise, which is a community of approximately 26,000 people in the Sierra Nevada foothills. It was driven by extremely dry vegetation, strong winds, and steep terrain. and the fire spread with extraordinary speed. Within hours, large portions of Paradise were engulfed in flames, and the wildfire ultimately resulted in 85 deaths. It destroyed more than 18,000 structures, and it burned over 150,000 acres. Entire neighborhoods, their schools, their healthcare facilities, and their critical infrastructure were gone. The campfire illustrates how rapidly evolving disasters can overwhelm communities, and it highlights the importance of preparedness at the household, community, and healthcare level. So let's talk about the timeline. We already said that the fire spread quickly and many residents only had minutes to evacuate. The evacuation routes became congested as thousands of vehicles attempted to leave Paradise at the same time. So in the early morning of November 8th, the fire ignited shortly before 6:30 a.m. Investigators later determined that the likely cause was electrical transmission equipment owned by Pacific Gas and Electric. At the time of ignition, conditions were extremely hazardous. Relative humidity was very low. Vegetation was critically dry following a prolonged drought. And there were strong Diablo winds that exceeded 40 to 50 miles per hour. These conditions allowed the fire to spread really fast in the forested areas. So within less than an hour, the fire had grown significantly and began moving toward Paradise. Residents began receiving evacuation alerts, but the fire was advancing faster than expected. By 8 a.m., evacuation routes were already becoming congested, and many residents were forced to flee through dense smoke and falling embers. By midday, as the fire entered Paradise, structures began igniting throughout the town. Many homes burned simultaneously due to the wind-driven embers that were igniting roofs, vegetation, and structures. Traffic gridlock occurred along the town's limited evacuation routes, and some residents abandoned their vehicles and fled on foot, while others sought refuge in parking lots and open areas. So the Camp Fire did become the deadliest fire in California history. As I said, 85 people died and over 18,000 structures were burned. Thousands of residents were displaced. The long-term psychological trauma was massive, and many fatalities occurred because residents were trapped in vehicles during evacuation attempts and were unable to evacuate because of their own mobility limitations. Imagine if 18,000 homes burned in your community. Nearly 95% of, what would you do if 95% of your community was destroyed? Schools, healthcare facilities, and municipal infrastructure was lost. So the destruction of housing created a long-term displacement problem, with many survivors relocating to nearby cities. Now, one of the important things as a nurse to consider are the health impacts. So wildfire smoke contains fine particulate matter that penetrates deep into the lungs and the bloodstream. This can worsen asthma, COPD, and cardiovascular disease. The health impacts of the campfire were significant. The wildfire produced health consequences that lasted well beyond the immediate injuries. You also have burns and trauma. So residents and first responders experience burn injuries, trauma from falling debris, multiple vehicle accidents during the evacuation as people got impatient or careless. And then wildfire smoke contains PM 2.5 and toxic gases. So those exposures can cause respiratory distress, asthma exacerbations, chronic obstructive pulmonary disease, flare-ups, increased cardiovascular risk. And so the air quality in Northern California reached hazardous levels for weeks. It wasn't just the immediate impact. And then, of course, there's the mental health effects. The psychological impacts were profound. Survivors experienced acute stress reactions, PTSD, depression, grief, and loss that was associated with their community destruction. The hospitals and clinics in the region experienced patient surges related to respiratory distress and injuries, while also managing evacuation and infrastructure disruption. The healthcare system faced multiple challenges all at the same time. So the hospital and emergency departments saw increases in respiratory illness, burns, trauma, anxiety, and at the same time, some of the facilities in Paradise were forced to evacuate themselves due to the advancing fire and smoke. And healthcare workers had to balance evacuating vulnerable patients, treating the incoming cases, and managing staffing shortages. Remember, they lived there too. They had homes and families. Hospitals in the surrounding community absorb the displaced patients and evacuations, but then that puts additional strain on them and the entire regional healthcare system. So, what are some preparedness lessons about evacuation planning and alert systems? The campfire illustrates how quickly disasters can overwhelm communities and how important evacuation planning and early warning systems are. The campfire provided several critical lessons about disaster preparedness. First of all, evacuation planning. Communities with limited evacuation routes are particularly vulnerable during fast-moving disasters. Improved evacuation planning and traffic management is essential. Emergency alert systems must provide clear, timely, and accessible warnings to allow residents sufficient time to evacuate. And then there's your household preparedness. Many residents were forced to evacuate rapidly without essential medications, documents, or supplies. Household preparedness can significantly improve safety during evacuation. And then hospitals and clinics have to have disaster plans for rapid evacuation, patient tracking, regional coordination, and surge capacity. Implications for us as nurses and as public health professionals? Well, for nurses, we play an important role before, during, and after disasters like the Camp Fire. Nurses can educate patients about emergency planning, medication preparation, evacuation strategies, and then in disaster response during the disaster, nurses serve in roles like emergency triage and shelter healthcare services and public health response teams. In community recovery, nurses often provide ongoing care for individuals affected by chronic disease disruption, smoke-related illnesses, and psychological trauma. Okay, there's a bee in my room, which is odd this time of year. So let's talk about more implications for public health and nursing. Nurses played important roles before, during, and after disasters like the Camp Fire. So here are some discussion questions for you. And I would like you to think about these. Write down your answers. And you don't have to turn this in. I just want you to think about it. And imagine that these discussion questions related to your community. So, why did evacuation become so difficult during the campfire? How might it become difficult in your community? What preparedness actions might have reduced loss of life? How should healthcare systems prepare for wildfire related patient surges? Well, you live in New Mexico. This is really important. It is the greatest risk we have here of disaster. And what role can nurses play in educating communities about being prepared? Okay, Section 4. Nurses play essential roles in disaster preparedness and response. Nurses educate patients about preparedness planning, and they help communities build resilience. They also do community outreach. During disasters, nurses perform triage, provide shelter health care, and assist with public health interventions. Because nurses are trusted by communities, they are effective leaders in promoting preparedness and risk communication. So, in the final discussion, I want you to think about barriers including risk perceptions, cost, and lack of awareness. So, what are some key takeaways for this module? Well, preparedness uses an all hazards framework. Emergency management increasingly relies on all hazards approaches, which focuses on building response systems that focus across many disaster types rather than creating separate plans for each hazard. Core capabilities such as communication systems, incident command structures, evacuation planning, and medical surge capacity are applicable to hurricanes, wildfires, pandemics, and technological disasters. Preparedness occurs on multiple levels. Effective disaster preparedness requires coordination across several interconnected levels: individuals and families, communities and local governments, healthcare systems, public health agencies, state and federal emergency management systems. And weaknesses at any of these levels can compromise the overall response. 3, households are the first line of resilience. Individuals and families play a critical role in preparedness. Guidance in Are You Ready? An in-depth guide to citizen preparedness emphasizes 3 basic actions. Make a plan, communication and evacuation planning. Build a kit, emergency supplies, medications, and documents. Stay informed of alerts and hazard awareness. Household preparedness reduces risk and it helps prevent overwhelming emergencies. And 4, community preparedness requires coordinated planning. Communities develop preparedness strategies through emergency operations plans and coordination among emergency management agencies, public health departments, health systems, fire, EMS, and law enforcement, volunteer and community organizations, and many, many more. These partnerships allow communities to coordinate evacuations, shelter operations, medical response, and risk communications. And I would add one more thing. Health systems must prepare for disaster impacts. Hospitals and healthcare systems prepare through emergency operations plans, disaster drills, which you should take seriously, and surge capacity planning. Some of the common challenges during disasters include sudden increases in patient volume, infrastructure disruptions like the power going out or the water going out, supply shortages and staffing challenges, and healthcare preparedness um, for that is essential to maintain the continuity of care. And of course, we talked about the wildfires as a good example. So I would say the overall takeaway here is that preparedness is a shared responsibility, and strengthening preparedness at the household, community, and healthcare system level improves disaster response and helps protect population health. Nurses are essential partners in this effort. Thank you for being here, for taking the class, and for learning how to prepare yourself and your community.